Since health was devolved, there have been calls to the 47 counties to step up measures to deal with any outbreak, including the newest and deadliest coronavirus. And since the Ministry of Health has reported a surge in the number of new cases, and in particular counties, the situation is now dire. Even more worrying are the incapacitated hospitals in counties, as admitted on Wednesday afternoon by the Council of Governors. Council Chair Wycliffe Oparanya pleaded for more ICU beds, as only 25 counties had the facility, with a total of 162 ICU beds cumulatively.
Currently, only 24 counties have functional ICU facilities. 14 counties of these having benefited under the MES project. The total number of ICU beds in all the counties is only 162.
Oparanya now wants the national government to come to their rescue before the COVID-19 situation in the country blows up to unprecedented disaster. Inadequate personal protective equipment is also proving to be an issue in all the counties, despite the government's effort to procure some and get donation from a philanthropist. With only 161 ventilators in the county ICUs, counties now require 300 more.
This shortage poses a serious challenge of vulnerable of health workers in the response. Testing for COVID-19. Only 2 labs at the national level, at Kemri, for example, at Kemri and National Influenza Laboratory are able to test for the virus currently. This is in itself a great risk for the country should the disease spread rapidly in many counties at the same time as is projected in the coming weeks.
A clear sign that more needs to be done if the counties were to join fully in the fight against the virus and possible outbreak. For instance, Governor Wycliffe Oparanya says his county has only 9 ventilators out of required 500 and only 300 PPE kits as opposed to recommended 1,000.
We had the meeting with the national government, and the national government has agreed to support additional staff to counties, 6,656 health workers in different cadres for COVID-19 emergency only.
On issues of boarding schools, on issues of cess, making sure we don't charge things from Membu passing through Nyandarua or through Kilicho. These are things we are working on. The issues of KPLC, we are working with them not to disconnect water systems or health facilities if they don't pay. They pay their bills. We are also not disconnecting waters to our citizens. And in the informal centers, like the colonial villages, we are giving free waters to those people.
Daniel Karaoke, K24, Evening Edition.